Okay, this is the All Hazards Consortium's webinar entitled Hippocrates from Health to Emergency Management. I'd like to thank the State of New Jersey for supporting us with today's presentation. And at this time, I'd like to introduce Mr. Tom Moran, who is our Executive Director of All Hazards Consortium. Tom?
Good morning, everyone. I'd like to welcome you to our webinar on Hippocrates from Health to Emergency Management. Our speaker today is Mr. Dave Gruber. Dave received his BA in microbiology from Rutgers University and his master's in strategy from the U.S. Army Command and General Officer Staff College. He spent 21 years in the U.S. Navy, serving as a pilot, intelligence officer, and chemical biological warfare specialist. After retiring from the Navy, he was the senior planner for the Dallas County Health Department in Dallas, Texas. From 2003 to 2010, Mr. Gruber was the Senior Assistant Commissioner at the State of New Jersey's Department of Health and Senior Services, where his responsibilities included Public Health Department oversight, emergency preparedness and response, and the Office of Emergency Medical Services. During this time, he was also Director of the New Jersey State Public Health and Environmental Laboratories. Mr. Gruber is now the Special Assistant to the Director of New Jersey's Office of Homeland Security and Preparedness. So with that, I'd like to introduce Mr. Dave Gruber. Dave?
Thanks for the opportunity to speak today, and thanks to all of those on the webinar for joining this All Hazards Consortium effort. What I'd like to do is go over something that I believe is consistent with the goal Tom stated of partnership and integration of private and public sector. And that has to do with a initiative that I hope might gain ground, which is a National Homeland Security Knowledge Management Information Brokerage Initiative, in which the pilot will consider the use of our Hippocrates. So the proposal for a Homeland Security Knowledge Management Information Brokerage pilot would consider Hippocrates a high-level information technology architecture, which I'll go into in a future slide. I will show some use case studies in which we've done some mini pilots, explain how we've taken what was originally developed as a health system and now have expanded it to more encompassing and more along the lines of composite homeland security, and some suggestions for moving forward. So to put this in perspective, the idea of a National Homeland Security Knowledge Management Information Brokerage pilot with the goal of demonstrating national public-private, non-governmental organization, DoD, and Homeland Security integration of non-classified information using what exists both at the state and federal level with no cost to participants during proof of concept, and championed and driven by the All Hazards Consortium, which obviously is focused on public and private consortiums. Before I go into the diagram below, well, actually, let me go into that. Then we'll launch into a poll to get some feedback from those on the call about what you may or may not have heard about the system. So the whole goal here for the pilot would be to look at incident management across the broad range of Homeland Security organizations that's seen in the left part of the slide, blend it together, and using a high-level architecture, put together that composite picture with generation of a composite report available to private, public sector, NGOs, and DoD. So, Laura, if we could launch the first poll, please. Okay, so the results are that about 26% have heard about it, 53% have not heard about it, 16% are users, and 5% have accessed the training mode. So let's discuss what Hippocrates is, and this is just the log on screen, so next slide. Okay, Hippocrates is a high-level architecture that allows for data collection, integration, visualization and display, analysis, and knowledge management and information brokerage. It's a web-based application that was developed, managed, and is owned by the New Jersey Department of Health and Senior Services and New Jersey State Government. And it's the software bone for New Jersey's network-centric health emergency preparedness and response network. And the definition of the network-centric network is one that brings together, when necessary, all components of the health systems in New Jersey in response to large-scale incidents. And as can be surmised by the scope of that, there needs to be some way to link all of that together, not only in the formation of a command and control structure, but some sort of information backbone. And that's what we're using Hippocrates for in New Jersey. But more importantly, it's a component of the all-hazard system in New Jersey, plugging into the state's emergency operating system. And what we've noticed is through development of the system, Hippocrates now provides the capability to incorporate more Homeland Security information than before, as well as the health information. Next slide, please. So, continuing on, Hippocrates is an enabling system that unifies multi-jurisdictional private, public, and philanthropic sectors through knowledge management, information brokerage, in support of Homeland Security, community resilience, and continuity of society. And I think now is a good time to shed a little light on that term, knowledge management and information brokerage. Quite frankly, it's a refinement of the term situational awareness, which right now has probably become an amorphic cliche that describes almost any system. So when we talk about knowledge management, we're talking about the collection, storage, and visualization of data. But then once you have that data, instead of just shotgunning it out, there's the information brokerage component, which describes and frames the appropriate dissemination of this information to the right people at the right time. And I think that is a much more important concept than to, again, use that generalized term of a situational awareness or emergency management system. So Hippocrates does, in fact, support this, both through the support of the knowledge management aspect of it. It allows for analysis and assessment of data, resource management, and, of course, the information brokerage across sectors and agencies. And I should mention that right now, Hippocrates is, in fact, a private-public system, as many of the hospitals, long-term care facilities, and other private health facilities in New Jersey are users of the system. Next slide, please. And what I just did was put a screenshot of Hippocrates up there, just so instead of me just showing some words, you saw what the system looks like. It is not, I'm not going to go through an actual demonstration of the system. However, to get a feel for look of it, I've just put the screen up there. Some things to note on it are the symbologies are that are displayed. The red and green ambulances are GPS ambulances in New Jersey. We are currently capturing real-time advanced life support ambulances in the state. We're also capturing real-time air ambulances that are flying in the state. Much like any other system, there's the symbology for command centers, for incidents, etc. And on the top of the screen where you see the tabs, you see the different modules that are currently in existence to include operations, healthcare facility data, hospital divert data, generalized data collection and analysis, and communications. Next slide, please. So some of the feats that go into Hippocrates are listed here, and I think it's important to note that it was very significant to include dynamic displays on maps. Instead of having just static layers as in the traditional GIS systems, Hippocrates' development made sure that we were able to watch things unfold in front of us. So when you look at the real-time data on the right side of the screen, you see that, as I mentioned before, ambulance locations are there and are seen real-time. As incidents pop up and are entered to the system, they come up real-time. Weather and traffic, and I should mention that the weather feed that we're getting right now is IPAWS compliant, and will be compliant with the FEMA CAT system when they unveil it. Medical stockpile, real-time data, situation surveys regarding hospital status, and real-time hospital divert status, all dynamic feeds into the, along with standard layers on any GIS system, and some static layers as seen in the health layers, which include locations of hospitals with hospital data. Time for another poll, so Laura, if you could launch the next one, please. So 57% are expressing a general curiosity, 13% indicate that the organization needs a system, and 30% have seen Hippocrates before and are interested in it. So some of the existing Hippocrates capability, and I think the top one is probably one of the most significant ones as you look at cross-organization, cross-sector information. The information that is entered and used in Hippocrates is controlled by the user, and the user has overarching control of this information as far as sharing, whether the information is elevated to a higher level or whether the information is not available. And the development model focused a lot on this control of information so that those using the system would be comfortable in knowing that when the information went into this general web-based system, that only those who the user wanted to see the information were able to see the information. Again, some, information that goes across critical infrastructure, private, and NGO sector capabilities. It's a web-based system with access via username and password, and each individual that logs onto the system or organization has its own profile, which is part of the security module. It has a unique data collection and dynamic visualization model, and the unique is described as unlike traditional surveys or questionnaires that go out and bring information back in and you can see the results of the survey alone. Hippocrates integrates the results of a data collection survey into an overarching database, allowing for cross-sharing of that information into other modules and into other databases. So, for example, if a survey went out and asked for the number of hospitals that were able to respond to a particular event, not only would we get something that said 10 hospitals were able to, but we would also be able to display those hospitals on the map. We'd be able to create reports, and we'd be able to update other databases automatically. And there's also user-defined parameters in that these questionnaires and surveys can be created at the desktop level. There is an administrative security aspect to it, where just because you create a survey doesn't mean you can necessarily send it out on your own. There is the administrative oversight. But the fact that the user at the desktop and any user can create these surveys, can create these collection forms is a very powerful tool. There's also dynamic resource tracking, and this falls into the data collection, where there are certain standing, I'll call them standing surveys, but they're standing collection modules in which when the information comes back in, it automatically updates a dashboard. So, for example, our EMS task force is monitoring their equipment, their information, and as the status of that information changes, that information automatically updates on the EMS resource tracking dashboard. We're also looking at NDMS, or National Disaster Medical System, bed status collection that way. There's advanced GIS mapping capability. We tried to take away the generalized look at the GIS map so that people weren't intimidated by the mapping capability, but the ESRI backbone, ArcGIS server, allows for the bringing in of layers, much like any GIS system, and allows for multiple analysis capabilities. And there's an incident management system with an automatic executive summary creation so that as individuals or groups add information